Thyroid eye disease can present in many different ways. The first symptoms are often just an abnormal appearance of the eyes, and the earliest one would be the upper eyelid in one eye starts to go high, so you can see more of the white of the eye, and that can be associated sometimes with grittiness or watering of the eyes, particularly if you go outside or in cold weather, your eyes can water. So those would be the earliest features. As the disease gets worse, some people get double vision. Typically that starts first thing in the morning, so when you wake up for 5 minutes you get double vision, and then that might progressively get progressively worse during the day, or come back later on at night when you're feeling a bit tired. So early morning double vision, and then vision double vision in the evenings will be a significant progression of the disease, and then occasionally it can present with the actual vision itself being affected, so difficulty reading or difficulty seeing, reading number plates and so forth, and difficulty that would go along with difficulty with colour vision, so colours can look different in each eye, and that reflects the pressure behind the eye building up and squashing the nerve serving the vision, the optic nerve. So it can present in quite a wide variety of ways, and it's not always the same in everyone. Abnormal eyelid positions are almost universal in people with thyroid eye disease. So if you look in the mirror and your eyelid positions look the same they did as when you were 21 in old photos, then it's probably not thyroid eye disease, although that doesn't 100% exclude it. But the majority of people with thyroid eye disease will have abnormal eyelid positions. And when you go to the clinic, it's often useful to bring some old photos, and the doctors can see how your eyes have changed. If you start to get double vision, particularly first thing in the morning and then late at night, that's a really characteristic sign of moderate to severe thyroid eye disease, and there will be almost no doubt in the context of someone with Graves' disease that you've got thyroid eye disease if that happens. And then there's a large grey area where people may have grittiness or wateriness of the eyes, and that could be thyroid eye disease, but it could also be hay fever or conjunctivitis or a variety of other things, and that grey area leads to sometimes a delay in diagnosis of thyroid eye disease. But once again, if you've got those features of grittiness, wateriness, and your eyelid positions are abnormal when you look, and when it's asymmetrical, because it doesn't always happen the same in both eyes, you can have one eye that looks like this and the other eye looks normal, then it's very obvious. When it's symmetrical in both eyes, then you need to refer back to old photos to see the change in your eyelid positions. But that combination would mean it is likely to be thyroid eye disease. Thyroid eye disease is caused by an immune response against the tissues behind the eye, and it turns out that the thyroid stimulating hormone receptor, also known as TSH receptor, that is the target of the Graves' thyroid overactivity, the Graves' hypothyroidism. There's also a small amount of that same receptor in the tissues behind your eye, and the immune response against your thyroid overspills in, if you like, in severe cases, to the tissue behind the eye, and that causes enlargement of the eye muscles behind the eye, and also immune cells to pack into that space behind your eye, with the skull behind and the eyeball at the front, and that leads to increased pressure, which pushes your eyeball forward, and that leads to the abnormal eyelid positions and a lot of the other inflammatory features of thyroid eye disease. About 40% of people with Graves' disease will get thyroid eye disease, but in the severe form, where people have functional or real visual disability, that is double vision or loss of vision, then probably only about 5% of people with Graves' disease will get that severe thyroid eye disease. So for the majority of people, with Graves' disease, thyroid eye disease, is mild in its effects on the vision. Doesn't mean it's a mild disease, because still a change in the shape of your eye can be quite disfiguring to your eyes, and that's very distressing for people, because if you meet someone new, the first thing you do is you look into their eyes, and if you feel uncomfortable about that, or you look away, people think you're a shifty character, or you're upset, or there's something wrong with you, and so even though the disease in severity terms can be mild, the impact it has on someone's functioning can be actually very significant. And people are very self-conscious, particularly about their eyes, so what the doctors use as a classification of the severity of eye disease in terms of its clinical manifestations is often very different to how people perceive it. And of course, a young woman with thyroid eye disease may be profoundly affected by what we think is mild eye disease, and exactly the same disease in an old gentleman who doesn't really care about how his eyes look will have almost or may have negligible impact on their quality of life. The treatment of thyroid eye disease is targeted at the specific effects of the disease, and they're quite a wide range of different problems that people present with, and that leads to a variety of different treatments. Typically, in people with mild disease, the treatment is reassurance that for everyone with thyroid eye disease, it goes through a phase where it's active and it's getting worse, but if it's mild, eventually it'll stop getting worse and it'll start to spontaneously improve. And typically the natural history of that is about 12 to 18 months, sometimes up to 2 years for more severe disease. And so it can be, we say, self-limiting. It gets better spontaneously, and you may just need some eye drops if you've got a lot of watering of your eyes, or a lot of exposure of the white of the eyes leads to dryness of the front of the eyes, which is what causes the watering. So eye drops. We know that because it's due to the inflammation, there's a mineral called selenium, and selenium is an antioxidant which helps with inflammation. So there's a clinical trial showing that selenium is beneficial, and you can either buy selenium supplements from Boots or other pharmacies are available, or eat Brazil nuts, which contain a large amount of selenium. So 2 or 3 Brazil nuts a day is apparently enough selenium to dampen down the inflammation. So that would be the very mildest sort of thyroid eye disease. If you get double vision or more profound inflammation in your eyes, such that your eyes are bulging, there's a lot of white showing, and there's inflammation, your eyes go red or pink, or your eyelids become very puffy, then sometimes anti-inflammatory treatments like steroid infusions will be the next step for treatment. And then in severe cases, when the optic nerve is threatened and your sight starts to go bad, then we can take away some of the bone behind the eyes to relieve the pressure, which is a surgical approach. So normally in someone with moderate to severe eye disease, they might undergo a 12-week course of steroid infusions, which would dampen down the inflammation, and then we would see how it goes. Sometimes those are followed by tablet treatment, which are also anti-inflammatory, immunosuppressive treatment for a period of time. Sometimes when all the inflammation has gone away, people are left with residual deformities, disfigurement around the eyes, such as puffy eyelids, or the eyes are asymmetrical, or more prominent, more pushed out of than their original positions. And so rehabilitative surgery with either orbital decompression, which allows the eyes to drop back a bit into the skull, or just to realign the eyelids and make the eyelid positions better, or to realign the axis of vision if you've left with double vision. Those things can all be done after the inflammation of the disease has burnt out. So these are all reasonable treatments, your eyes probably will never go back to looking the way they were when you were 21, but they can look like you don't have thyroid eye disease anymore, and you can be left with symmetrical and comfortable eyes, and they are likely to be different, which is not a minor thing, but it's the best we can do at the moment. One of the most important causes of thyroid eye disease is smoking, and 20 years ago we did a survey of patients in our thyroid eye disease clinic, and about 90% of people in that clinic were cigarette smokers. And at the time, the prevalence of smoking in the general population was about 30%. So it's really is a strong risk factor. So the most important thing you can do if you have thyroid eye disease is to stop smoking if you're a smoker. Also, if your partner smokes or you're exposed to smoking environments, obviously try and persuade your partner to stop smoking, but also just try and keep out of that environment if it's possible. It's extremely rare for people with thyroid eye disease to lose their sight, but if you feel your vision is changing, you can't read out of one or both eyes, or particularly if colours look dim in one eye compared to the other, and typically people describe that as the colours look faded or washed out or pastel-y, then that's a sign that the nerve behind the eye is becoming squashed, and that would lead to urgent treatment within a few days, and you should get to the ophthalmology casualty to report that if it happens. Thyroid eye disease is best managed in a combined clinic with both ophthalmologists or oculoplastic ophthalmologists. So those are eye doctors who specialise in orbital surgery. That's surgery of the structures around the eye, not necessarily in the eye itself. And physician endocrinologists who can supervise the thyroid management and the immunosuppressive therapies if necessary. So for mild thyroid eye disease, often it will be just acknowledged by your endocrinologist, and they will do a quick eye assessment and decide if you need to go and see the ophthalmologist for more advanced treatment, or whether at the moment it can be managed with eye drops and selenium. So for the vast majority of thyroid eye disease, the endocrinologist can prescribe you eye drops and the necessary selenium, or you can get that yourself by buying Brazil nuts, and you won't need to see an ophthalmologist. If you start to get a lot of inflammation in your eyes, they go red or very prominent, or you get double vision, then you will need to go to see an ophthalmologist, and ideally that should be a combined thyroid eye disease clinic. And the large centres across the UK have these clinics with both endocrinologists and ophthalmologists to manage the combined effects of the disease. Unfortunately, not everyone's thyroid eye disease improves when your thyroid levels become normal, and thyroid eye disease tends to start roughly around the same time as thyroid overactivity, give or take 4 to 6 months in general. But despite control of the thyroid overactivity, in some people, thyroid eye disease will progress for 6 to 12 months or longer. Sometimes it can happen a year or two after you've had thyroid overactivity as well. So there's no strict line or sequence of diseases that happen. Sometimes, occasionally, thyroid eye disease can predate the Graves' hypothyroidism, and sometimes it can happen 5 or 10 years afterwards. So these things are a little unpredictable, but in general, it will happen roughly the same calendar year, if you like, or the same year as your hypothyroidism. But despite control of the hypothyroidism, some people it still carries on progressing. Once again, we know smoking is one of the things that will predict it will progress and carry on getting worse.